Please welcome to the stage President and CEO of Blue Shield of California, Paul Markovich, and CEO of OODA Health, Giovanni Colella.
Hi, Paul.
Hi, Gio.
Hello. Whoa, this is terrific. So, if you had told me 10 years ago that I was going to be on stage with a health plan to talk about how we can make the world a better place and health care better for everybody, I would have asked you, what are you smoking today? This will never happen. And after Relay Health, which is the first company I started, I'm a physician by training, but after that I started Relay Health and then Castlight. A lot of lessons I've learned, and there was a lot of thinking going into what do I want to do next. And at that point I really thought, okay, I want to build something that is going to be a legacy and that is going to really have an impact on the delivery of care like nothing we've seen before. And how do we do that? It's only through scale and working with great people. And literally, I don't want to take you through the whole intellectual evolution of how that happened, but I really came to the conclusion that we won't change American healthcare unless we work with health plans, with the players that have scale, have volume, and have a vested interest at this point in changing the system before somebody changes it for them. Because the other solution, the other alternative, is socialized medicine. And we can, I'm totally open to discussing that. I come from Italy where we have socialized medicine. The bottom line is it's not going to happen soon in the United States. And so I started thinking about that, and I said, okay, well, let me brainstorm with some visionary health plans. And right away I called my friend Paul. It was the first phone call I did. And I still remember that phone call. I remember that day when I called you because it lasted literally 5 minutes and Paul said, I'm in. Let's do this together. And it was one of the best things that has ever happened to me in my life as an entrepreneur. I started running by Paul the idea of, this is the vision. Let's create something where we can actually have a real, true retail experience in healthcare. A world where the consumer actually walks into the doctor's office and knows when they walk out, or even before they walk in, what they're going to pay for. Where a doctor can actually focus on providing good care. We have the best trained physicians in the world in America, and they're spending time doing a lot of administrative stuff and things like that. And a world where the health plan has actually literally focused on the consumer experience and on running the business of healthcare. And in order to do that, we need to get the doctor paid right away. No more 3-4 months back and forth. We need to get the whole prior authorization process, which I call malignant at this point, back in shape. And we need to get this relationship working in a different way. So can we build a platform that does this? And can you, Paul, help me? And I'll pass it on to you, Paul, and see why did you decide that this was
you
doable? Called
and we're looking for visionaries, and I said, I know a few people. Let me see who I could refer you to. That was the first 2 minutes of the conversation. It was pretty much a no-brainer. When at Blue Shield of California, we talk about creating a healthcare system that's worthy of our family and friends and sustainably affordable. And we came recently and belatedly to a decision that probably should have been obvious, and that is you need to take care of the people who take care of our members in order to have a shot at making that a reality. And yet, if you look at the way it works today, we've got highly trained physicians who are very interested in treating patients, and what are they doing? We've got them doing data entry on electronic medical records, and we've got them running small collections agencies. It gets, when you're at a patient level or a member level, at a time where you've got great stress and you're dealing with something health-related, which if you're repeatedly going to visit either the physician or the hospital, clearly there's something going on you're trying to recover from. You're not at your best. And at the time you need help and comfort and support, you're getting 6-page, densely written legalese in the form of an explanation of benefits telling you what you owe from that visit. And then for the health plan standpoint, we spend about $200 million a year processing claims, answering phone calls related to claims, and paying late interest on claims. So the current system just does not function well for anyone, clinicians and providers, members and patients, and health plans. And so the idea of coming back and saying, well, why shouldn't this be like leaving the grocery store? You know, when you leave the hospital or you leave the physician's office, you know, when you leave Safeway, you don't get a document 6 weeks later telling you what you owe for a jar of yogurt that you bought while you were there, right? There's no reason we shouldn't be able to do this all, you know, a complete real-time claims payment in every single venue. When you leave the office, when you visit, when you leave the hospital, why can't we figure out how to make that payment happen completely? The health plan's portion and the consumer's portion together, right there, all on the spot. And so it was like, wow, this is powerful stuff, and we were in right away.
So the question probably is, well, how are you going to make this happen? There's, you know, OODA Health, and I'll have opportunities to talk later about the entire endeavor of OODA Health. It's the company we co-founded, Seth Cohen and I, and a founding team about 6-7 months ago. And the idea was, let's work with visionaries to create a platform where we can allow this seamless and flawless payment system to advance in real time. I mean, in every other industry, this works. You go and see a doctor now, it takes, I remember when I was practicing, it takes you forever to get paid. There's bad debt, there's co-pays that the doctor needs to go after the patient for that. That should disappear. That shouldn't happen anymore. And that's the mission we went on. So how do you do it? First thing, I mean, it's been a busy 6 months. First thing you do is you look for visionary in the ecosystem. And so on the doctor side, we're really proud. We went to talk to Dignity Health and Hill Physicians because we wanted to be based in Northern California so we could focus for our pilots. And immediately they came in, and we're really, I mean, it's so impressive how these doctor groups are working with us. And obviously, this is one of those few things in healthcare where if it works, actually, let me correct myself, when it works.
When it works. Thank
right?
you, Gio.
Not if it works. When it works, it's going to be a win-win where, you know, there's the win-wins where somebody tries to take the hyphen. This is actually a win-win where nobody takes the hyphen. It's truly a win-win for everybody. So doctor groups, then we decided to work with other health plans. And here's what's the incredible that has happened. In Northern California, as you're all aware of, you know, one of the complexities of the system is that you have health plans. Doctors have small practices with different, you know, if I'm a doctor, 10% of my patients are Blue Shield and they're Anthem. Well, Paul very kindly and Gail on the Anthem side said, we'll do the pilot together. Anthem came in, and we'll do it in North California, working together, Blue Shield and Anthem, which I think it's pretty unheard of, right? It was like, I was like, really? This is going to happen? And so it was great. So this immediately gives you about 80% of a doctor's panel when you do that. In Arizona, the new CEO of Blue Cross Blue Shield of Arizona, Pam, was great. Dignity came on board there, so we're launching pilots. And really, the way it's going to work is health plans, providers, and OODA are going to work together on a cloud-based platform in which the moment the doctor sees a patient, they get paid in real time. Now, real time, the complexity of real time in healthcare is always that it's not exactly real time, but they get the guarantee of the payment right away. The copay and the deductible now is paid by the payer, so the doctor's out of the business of having to go and chase their patients, not to have them take their statin, but to take their dollars, right? It's a whole different perspective from a physician standpoint. They're out of the business of chasing the patient for money. They can follow the patient for care. And the consumer, like in every other industry, gets right away a statement saying, this is the work that has been done on you. This is probably what is going to be your payment. We will work with you in it. So the health plan is building the relationship with them because then they are responsible for the copay and the deductible, which will still be there. And the system works better for everybody. We're pure technology, so we're going to be developing the platform, and the payers and the providers are going to be doing what they're really good at. So now, Paul, why would the health plan do this? Why would the health plan, take on this goal?
Well, the thing is, I think the value is pretty compelling. We just talked about that, right? The $200 million that we spend, the improvement in the physician experience, the hospital experience. Hospitals collect, 20 to 25 cents on the dollar in these high deductible plans. So taking that away from them, guaranteeing that, doing it, there's a lot of value to the providers, to the members, and to Blue Shield of California. But why do it with a startup? And to me, this is compelling, and I think there's going to have to be a lot more of these types of arrangements for us to be successful. And that is, I think to transform the system, you need two things. One is you need to have control over the system itself. I like to quote, I think it's Deming, who said, a bad system will beat a good person every single time. And I think that's true. What health plans have is the controls over the system. We control how the payment happens, the administrative policies associated with it, the medical policy, so we control that system. And you can't really make this happen or change unless you make changes to the system. At the same time, I will admit this of us, and I think of most health plans out there, we are not very good at reinventing the system that we created. We kind of fallen in love with it. It's complex, and we know it, and we understand it, and yet it's going to have to change dramatically. If you can imagine, in this case, we have a lot of situations where we say, well, we require this documentation or this piece of information or this clinical information before we'll prior authorize or pay a claim, and it creates a lot of lags and administration in the system. We're going to have to go to a system that's much more like what the credit card companies do, which is, yep, we've authorized payment, and there's hopefully a very small percentage of time where somebody's looking for a credit or a debit on the backside. And so you're going to have to change the system quite a bit, but we're not very good at reinventing it. So I think the combination of having, bright, energetic people who want to transform the system, who aren't captive to it, figure it out, who also are a third party, because you can imagine if Blue Shield invented it themselves and said, we've got it, we've figured it out, now let's go to Anthem Blue Cross of California, one of our biggest direct competitors, and let's have them run their claims through Blue Shield system. You can imagine what the response would be. Or if Blue Shield showed up to a physician's office by ourselves and said, we're a health plan and we're here to help. Right? You know how well that goes over too. So having a third party that can reinvent how this works, isn't burdened by the existing world, can play that third party role. And in your case, Gia, of course, you're being very modest, but have a serial success at getting startups to be successful companies. To me, that combination is what's going to make this possible.
Well, thank you, Paul, and thank you for the nice words. Serial luck doesn't predict future luck, but that's okay. We're constantly flipping the coin. So now my message to the entrepreneur on the other side, how is it to work with a big health plan? I mean, it's a different world, and let's start. The number one thing, like in everything in business, the most important thing is a high degree of trust. It's not easy. We come from a world where everything needs to be done tomorrow or yesterday. The health plan comes from a world where there's a layer of checkpoints that need to be checked before you can do something. So that creates, and the type of technologist that we hire is going to be different than the type of technologist that is in a health plan. So number one is trust. Every time there's a hiccup going on, there needs to be a way of communicating right away. And we've built that. And not only with Paul. With Paul, it's a natural for me because we go back. Paul and I started working together at Relay 20 years ago. So we go back a long time. But we've built it. We're building it. I mean, the world of the health plans is changing dramatically. What is it, 7 new CEOs in the Blues in the past 2 years or something like that? Past year, right? So, and we're trying to work with all of them. So it's a world that is changing, and there has to be trust in the fact that we're all aiming for the same goal, which is ultimately to wake up tomorrow and have a better healthcare system. Number one. Number two, be humble. Be humble. I mean, really, and I'm the first one to say that nobody had ever accused me growing up of being humble. And you really learn the hard way. You learn that the health plan job has been incredibly unfair. They've been asked to manage costs dramatically and never really allowed to manage care. And so it becomes a mission impossible, right? In the socialized system, the government is managing both. Here, the health plan is caught in a world where they can't do both if they're not allowed to do both. So be humble. Realize that there's a lot of steps that need to be taken as you work with a bigger company. And then there's the third piece, which is the financial incentives. Align the financial incentives. Make sure that, entrepreneurs like to have, and investors like to have, an exit strategy too. So make sure, and I'm not going to go into the details here on how we did that, but make sure that you have thoughtful partners that you want to work with, that understand that if you want to capture the value of the animal spirit of an entrepreneur and also allow that value to grow from adolescence, irrational exuberance to adult maturity within the big company, you need to work on both sides of the equation. And you need to really understand how to grow the small company in you or with you. And that's a challenge. It's a challenge we face every day. Every day. It's not easy on both sides.
Yeah.
On both sides. There is no doubts about that. But gosh, it's worth it. It makes life so much. I was talking to Seth and I don't know if he's in the room, my co-founder, and we both went to the Castlight experience together, and every time we go into a meeting with a health plan now and we're working together, it says, wow, life is so much easier when you can work together and you have goals aligned and things aligned. So it becomes really, you really see that you can scale. I want to close with one thing. The big lesson came to me about 2 years ago. I was actually talking to Gail, who's now the CEO of Anthem, and she was at that point in that window between United and Anthem. And one thing she told me that really made me think a ton was, gee, I've seen a lot of entrepreneurs like you have great ideas, come up with things. Don't underestimate the complexity of scale. You always get to a point in which you hit the wall. You get to that point in which you have all the visionaries with you, and then you can't go beyond that. Lesson learned for me. I hope that lesson sticks with other entrepreneurs here, because this is a team sport. And we cannot get into it with the idea, we do it all, they do it all, we have enemies. It's a different industry. There's so many different incentives, there's so many regulations. I'm sorry, we have very little left, so I don't want to take, I could talk forever.
I was just going to reinforce, Gio, your points, because I think, honestly believe, for the reasons I mentioned, that health plans have the control mechanisms over the system and can scale ideas. But entrepreneurs have the energy and the wherewithal to reinvent the system, get outside the box, as it were, that these types of partnerships are going to be important. And what comes naturally to a large plan and what comes naturally to an early stage company are completely different. And so there are challenges associated with it, and I think you hit on them. For us as a large plan, we had a couple situations already where we had to, for example, pick a couple of vendors to do transcription services, because you have to capture immediately in the moment a comprehensive electronic medical record in real time in order to do the claim in real time. So we were working with some transcription services, and when we first started, they were talking about how many months it was going to take to go through the procurement process and find them. And we had to say, no, we got to move quickly. So the idea is, it comes naturally to an early stage company to define success of an early stage venture as discovery. Move quickly, figure it out, make mistakes, right, and learn. For a large company, what comes naturally is making sure something can scale. Is this consistent with our architecture specifications for our IT? Is this consistent with our procedure approach? And so what you have to be able to do as an entrepreneurial firm can teach a large firm is how to get into that discovery mode and move much more quickly and realize you're only doing it on a small scale. And then later, once it's been successful, what the big plan brings to the table is the ability to scale. The ability to move those levers on the system broadly and drive broad scale adoption. So yes, it hasn't been perfect. We got a long ways to go, but I'm very excited for the journey.
It's going very well. I still remember the first meeting we had with your CTO, in which we came in, we're going to do this, and this, and we're going to do it this way. And nope, it has to meet the technology architecture of Blue Shield. And we went through laparoscopy. I mean, it was not an easy process. But wait, we came out much better. I mean, I really admit, and a lot of things have changed. And now we know we can, well, we don't know yet, but we're getting ready to scale with you. And more than anything, we understood the complexity of that. I don't want to sound overly exuberant that now we know and so we can go. Wow, he brought us back to reality. And it wasn't about who's better or worse. It's just about guys, we make an error here and there's millions of lives that get impacted.
Yeah.
And that's a wake-up call for us, because we were ready to walk out of that meeting and pretty much it was done.
My hope for next year is that we come back and tell you how perfectly this is working, and that the San Jose Sharks actually have beaten the Vegas Knights in a playoff series next year instead of the opposite. So, Gio, thank you.
Thank you, Paul. Thank you all. This way?
Thank you, Giovanni and Paul.